Hi there, this is Dr. Laura Purdy from Journey's Home Pet Euthanasia. We're starting on our second vlog post to kind of reach out to people about topics that are important to animals and their families at end of life. So today I want to talk a little bit about human hospice, how that's set up, and things that we can maybe glean from how the human hospice side of things goes, and maybe if there are a few nuggets that we can use to help our four-legged friends and our beloved pets at the end of life. So human hospice is a huge field of medicine, and there is so much that we could talk about human hospice. Instead, what I've done is kind of cherry-picked a few big concepts or kind of overarching philosophies and themes to how human hospice, in the hopes that that information can become relevant to us in the veterinary world and us as pet owners and pet lovers. So hospice care in human medicine is also a really ever-changing field. I follow a few Facebook pages and newsletters around palliative care and hospice in the human medicine world, and it seems like every day there is a new article, a new way of thinking about things, which I really appreciate, because the more that we think about and talk about these topics, the sort of better we can all do around end of life. So one of the big changes that we're seeing in human hospice and end of life palliative care is this move from being centered around the doctor, the hospital, or technology, to something that's more centered around the patient and the family. So sort of building our choices around the patient and the family rather than necessarily around the hospital or technology. The goal in human hospice seems to be moving from kind of what we think of as a typical doctor-patient relationship, more like, I think sometimes we imagine it more like a teacher-student or a mentor-mentee, so one person telling the other person the information that they need to know. So that's typically what we think of. But in hospice, in human hospice, there seems to be a shift to move from having the doctor and the patient work more as partners, or I really like the concept of collaborators. So both working together to achieve the goals that are important for the patient. So we remember in human hospice, the doctor is the doctor and the patient is the person experiencing that end-of-life disease. In veterinary medicine, we have sort of more of a triangle of collaborators and partners, at least in my opinion. So we have the veterinarian, and then we, as the veterinarian, we have two collaborators, two partners in this end-of-life walk. The first one is obviously the pet that is experiencing that end-of-life disease. And maybe it seems a little silly to talk about a pet being my partner or my collaborator, but I think most pet lovers, pet caregivers know exactly what I mean. They are able to a certain extent, tell us exactly what their preferences are. We can, to a certain degree, try and sort out what their goals are, what makes their life meaningful, what they enjoy and what they don't enjoy. So certainly I believe that our pets can be collaborators and partners with us if we're willing to pay attention to our pets at the end of life. And then of course, we have another really big partner and big collaborator. So we have the veterinarian We have the pet, and we also have the pet caregiver, or often pet caregivers. We need to work with your goals. What are your goals for this end of life process? What makes kind of life with your pet meaningful and important and enjoyable? What matters to you guys at the end of life? So, as I mentioned, that human medicine, we're working to be partners and collaborators, and I think that is very true and extremely relevant for veterinary medicine and for pets at end of life as well. So in my hospice and palliative certification course, we touched on 4 principles of hospice ethics in human medicine that could be, I think, appropriately also applied to our veterinary hospice and palliative care at end of life. So the first principle that was touched on is that essentially dying is a meaningful experience. A pet dying matters. It matters to the people that love him or her. It matters to them. And so it is always important to remember and be cognizant of the fact that dying is a meaningful experience. The second hospice ethic in human medicine that we think can also be applied to veterinary medicine is the fact that family-centered care is appropriate. And I think this is perhaps underutilized, but maybe even more important in veterinary care. We'll talk about this a lot more in upcoming vlogs, but essentially we're caring for the patient, and we're caring for that patient family too. And it's those relationships and it's that connection that is really, really important at end of life for the pet and the pet family. A third really important hospice ethic to keep in mind for our pets at end of life is to protect the integrity of that pet. So this one's a little bit tricky, I feel like, to necessarily nail down, but essentially we want to try and honor what they find valuable and meaningful. So if the sweet golden retriever loves spending time with his or her humans, we want to find creative ways when managing their end-of-life care to make sure that they can be a part of family activities, whether that means everyone going on slower walks, or maybe we get a little red wagon so that our golden can still go on walks and say hello to the neighbors, even if they are not mobile enough to make the whole walk on their own. For a kitty cat, maybe they really, really enjoy surveying their domain from a beautiful bay window. So maybe what we do is we build some little stairs so that the jump up to that bay window isn't so hard. Or maybe we put a little area there with a heating pad on low so that a kitty that is not able to retain body heat as well is able to have a comfy spot where they enjoy. So all of our care should keep in mind, kind of in the back of our head, what does this pet find valuable? What does this pet enjoy? What matters to this pet? And it's going to be different for every single pet, and that's why our pet owners and our pet caregivers are so important, why they need to be a part of this conversation, because they are able to answer that question often so much better than we are as clinicians. So I think keeping that hospice ethic in mind in veterinary medicine and at end of life is really important. Then a final and fourth ethic of human hospice that we can apply to veterinary medicine and for our pets at end of life is to address all aspects of suffering. And I think this is something that really gets to the heart of what pet caregivers, including myself, are so afraid of and scared for. We do not want our pets to suffer. So again, this is something I'm hoping to go into a little bit more in future vlogs. Essentially, what is suffering? How do we address that? How do we know that suffering is going on? But for now, I just want to touch on the fact that there are different ways that we can suffer, that pets can suffer. There is obviously the physical aspect of how we feel. Are we in pain? There's also, I think, a mental component of suffering. Our pets with really, really severe dementia. I think there is a level of suffering there, even if their body is functioning fine. They are mentally incapable of participating in normal activities and enjoying things that they used to enjoy. And then a huge aspect of suffering as well that I don't think gets touched on as much for people or animals is emotional suffering. If we're reaching a point at end of life where a pet is in significant distress or anxiety around what's happening to them, certainly we want to try and address that as much as possible as well. So I think that gives us a lot of really big topics to think about as far as hospice and end of life for people as well as animals, and what can be taken from one area of medicine and applied to another. So hopefully you at least gleaned a few new ideas or thoughts, ways of thinking about your pet at end of life and how we want to care for them. And we'll go into a lot more detail on some of these topics in future vlogs. Thank you again for listening to our vlog. I'm Dr. Laura Purdy with Journeys Home Pet Euthanasia. If you guys have any questions or comments about this vlog, don't hesitate to leave it in the comments or reach out to us, and look for another vlog hopefully coming up in the future to talk a little bit more about these topics. Take care.